Good morning, everyone. My name is Betty from Development Initiatives.
Good morning, everyone. My name is Paul from Development Initiatives.
Good morning. My name is Boniface Owino from Development Initiatives. Thank you.
Morning, everyone. Steve Kenny from Development Initiatives.
Hello, good morning, everyone. My name is Frecia Kamau from the Open Institute.
Good morning, Charles Wafula, EU.
All right. Thanks so much for that. I think what I would give is a little bit of history of where we've come from with the spotlight on Kenya. And DI being an organization that values the importance of data, promoting use of data, and also making data available, we sat down, I think it was in 2014, and we were doing some work with Ibp at the county level. Actually, it was under HIVOS. And we wanted to bring together the county budgets into one platform or in one place so that people can see how counties are spending the money. But it was a struggle, one, because that data is not available, it's not standard, it's not accessible. So really, that made us think, how then can we promote data to be available and to help other organizations use that data? So we've been thinking about this for the last, I think, 3 years now. And what we've done with the Spotlight, which Steve will take us through, is now we are overlaying socioeconomic data onto financial data so that we're able to see, so actually, do resources go to where they're needed or where it's required? And I think for us, setting up a platform is just the beginning. It's not the end in itself. It's just beginning a discussion around how can we promote better use of data, how do we promote uptake of data, and how do we support organizations also, and also government, of course, in terms of how do we ensure evidence-based or data-driven decision-making. Of course, that's a political discussion. It's not just about data. There's also some politics there. But I think it's the beginning of a discussion, beginning of analysis, beginning of an engagement around the Spotlight. So really, just to emphasize that, yes, it's a platform, it has data, it has good data, what we could get, of course, what's publicly available. But I think what we're more interested in is starting a discussion around data use and data promotion in the country, and even going to the subnational level. I think, given the time, I can stop there. I'll be back, of course, with the panel discussion, but I think I'll want to pass back to Henry. And of course, a very warm welcome from DI.
Thank you so much, Karen. So with Mugabe gone or almost gone, Africa rising or falling? I don't know. Thanks so much, Karen. So you heard about the Spotlight on Kenya, which we are going to launch today. And also in the course of this session, you will interact with us, and also Steve will give more explanation or more description about the Spotlight. The next person I want to invite here is one of our great friends, again, in Nairobi, in Kenya. I want to invite Dr. Jason from International Budget Partnership. Sorry, International Budget Partnership. Jason, you are from Ibp. I'm not trying to give you a job at DI. So welcome, Jason. Perhaps you give us your perspective on why is data important in fighting inequality. Welcome so much.
I hope I will live to see Mugabe also pass on, but I don't want to be that optimistic. I was in Zimbabwe 20 years ago when Kabila was taking over the Congo, and I've learned not to be too optimistic about such things. We were very excited at that time. So, good morning. I am Jason Lakin from International Budget Partnership. I'm the head of research for the global office, and also still providing some support to our Kenya office here. My colleagues Mokera and Abraham are here. And I was asked to just give a few remarks about data and inequality and poverty and policy, or something of that nature. So I will just say a couple things. I want to also thank Development Initiatives. We started Equity Week last year. Equity Week 2016 was the first year, and this is our second year of doing Equity Week, and Development Initiatives has been with us from the beginning. So we are happy to be together again this year at day 4. Just to say that tomorrow is the last day of Equity Week, but tomorrow's event will actually be held in Elgeyo-Marakwet County. We have a regional event this year, bringing together counties from the North Rift region to talk about issues around equity and inequality. So if you're not already planning to be there, it may be late to join us, but I'm hoping that event will be captured on film and possibly streamed as well. So to today's to the matters for today, I want to talk briefly about the importance of data in policy making, and I want to make things a bit less abstract by just mentioning 4 specific policies or policy areas where I think we've had some challenges in the last few years. And I want to just start by zooming out for a minute. And is there a microphone which is on that we could shut off? There's a lot of feedback. I think we all know that we are living in Kenya in an age of grievance politics, and these grievances that we are hearing about are not new. And they relate fundamentally to people's perceptions of fairness and perceptions of inequality. Who's getting what, and for how long they are getting it, and when others are going to have their turn. And those grievances are part of what drove constitutional reform, and they are part of what has driven our contentious politics since the Constitution was passed, and obviously seeing currently. And what I want to suggest is that one of the challenges that we face in trying to address these grievances, and not just repeating cycles of contention and violence, is that we have to bring together our perceived sense of inequality with some data about who's actually receiving what, and some policy ideas, so that we can come to the table and negotiate. Because ultimately, we can only resolve these grievances through negotiation and through a recognition that there are certain grievances which are legitimate because they are based on data that we can actually see. Because, as you know, in Kenya, it is very cheap and very easy to make claims that we are marginalized. If you go into a room and you ask people who's marginalized, everybody is marginalized. I have never sat in a room where anyone has claimed not to be marginalized. And those claims, it is not that those claims are not in any way legitimate, but we need to root these claims in data so that we can actually discuss how marginalized different groups are and how we accommodate them through some kind of policy changes, which will involve trade-offs, and some people getting some things now and other people getting things tomorrow, and so forth. So I want to then suggest that we need to bring together, in any policy area, what we are trying to do is bring together data about needs, the needs that different people have, and the finances that we need to address those needs.
of course, we should also have some idea, some policy theory of change, that if we put in money in a particular way to address a particular set of needs, it will yield a particular outcome. And therefore, things will get better and we will move on from there. So we take needs, finances, and some theory of how policy works, and then we get change. That should at least be how things work. I want to point out 4 cases where I think we are still struggling with these 3 things that I've just mentioned, so that it is clear that this discussion is not an abstract discussion and that this discussion has an impact on people's lives. I want to start with one of the early things that we worked on when I first came to Kenya, which was, 2012, let's say, 2013, which was around regional hospitals. When devolution began, or when the Constitution was passed, we assigned responsibility for different functions to different levels of government, but one of the confusing areas in this was who was going to be responsible for the regional hospitals, the so-called level 5 facilities, the former provincial hospitals, and a few other high-volume hospitals. I think it's obvious, although it didn't appear to be obvious to the media at the time, that the funding and management of regional hospitals is of fundamental importance to people's lives. This is not a theoretical issue. It's not a technical issue. If nobody's responsible for hospitals, people will actually die. So there was a lot of back and forth about who is going to be responsible for these hospitals, and in the end, the Transition Authority decided that these level 5 facilities should be managed by the host counties where they are located, so that they would be devolved. Now, in order for us to have a reasonable debate about how to manage and finance these hospitals, you would expect that the most fundamental information that we would need to have is how much does it cost to run an individual level 5 facility as of 2012-2013, the year before we devolved. That information was not available and has never been made available till today. If you go back to the budgets from 2012-2013 and before, you'll find lump sum figures for how much money goes to these regional facilities, but not individually broken down by facility, nor broken down further by the different things which that money would buy in those facilities. How much is going to workers, how much is going to inputs, how much is going to capital. So in order for us to have an intelligent conversation, a reasonable conversation about how these hospitals can be run in the best way to provide services to people and actually impact on people's lives, what we need is information about people's health, and we need information about the finances, and we need a theory about how we combine the finances with how we bring to bear the finances on the problem to solve that problem. But lacking any information about the actual distribution of funding for these hospitals, it is very difficult to have that kind of conversation. And we have continued today in this state of affairs. Last year before the elections, we had, or perhaps earlier this year before the elections, there was an event that was organized by Twaweza Communications at the Goethe Institute, where we discussed, excuse me, with stakeholders from the health sector. And it was clear that we cannot say today how much counties are spending on regional facilities, because if you look at their budgets and you try to understand how much money is going to these facilities, in addition to the conditional grant which exists from the national government, which finances these facilities, you will not be able to make any sense of these numbers. I looked at these numbers earlier in the year, and you cannot figure out how much is going to these facilities, how much is being spent on these facilities. So if we say that we have vast inequalities in access to health in the country, which we do, and we say that one of the primary mechanisms for addressing these inequalities is investing in health facilities, yet we have no data about how much it actually costs to run these facilities and how much money we're actually spending on these facilities, then it is very unlikely that we are going to be able to use this mechanism to solve this problem. And that is, in fact, where we are. That is what is happening. So that's one area where data is critical for making decisions that affect people's lives, and we lack that data, and we have not been able to bring together different sources of information to solve the problem. A second issue that I want to mention, also from the health sector, is around the free maternity program. The free maternity program, we all know, was introduced in a fairly ad hoc manner during the campaigns in 2013, 2012, 2013, by the president. And this program, presumably, is intended to address the problem that people need to go to facilities to deliver if they're going to have high quality skilled birth attendant care when they deliver, so that mothers don't die and children are well taken care of. And they're presumably struggling to do that because of the cost, and therefore the free maternity program has come along to reduce that cost so that people can access these facilities. I am not aware of any policy document that guides this free maternity policy. I have been told that such a policy document exists, but it has never been availed to me. There was a campaign document that was produced in 2013 as part of the election campaign, suggesting the policy to the president, which I've seen, but no actual policy document. So it isn't clear what kind of analysis went into the diagnosis, which I just gave a brief summary of. But we will skip ahead to where we are today, and the question of whether we have the data and are using the data in effective ways to address the challenges around maternity. If you look at the 2017-18 budget, you will see two things of interest. One, the government has claimed prior to that, but you can see it again in this year's in last year's documents, that access to skilled birth attendants has increased in Kenya from 44% before this policy was introduced to 66% a couple of years after the policy was introduced, to 77% in 2017-18. You will notice something funny about these numbers, those of you who are numerically inclined. 44, 66, 77. We can anticipate the next number will be 88. Yes, well, we don't know if it will be 88 or 99 because 55 was missing from our pattern. But anyway, so these are the numbers, but you will also find in the same documents that the target for in-facility births with skilled birth attendants is to rise from 59 to 63 in 2017-18. So we have either already surpassed, you can see that these two sets of numbers were generated by two different people or two different random number generating systems, because 5963 doesn't follow the pattern of 44, 66, 77. But in any case, we are either targeting 63% this year, or we have already reached 77%, and surely we are not targeting 63 if we have already reached 77. So if we need to have information about needs and finances and a theory of change about policy, then we have a problem on the needs side here already, because it isn't clear what the need is. Is the need the remaining 23% from the 77, or is it the remaining 37% from the 63? And moreover, if after several additional years of implementing these policies, we are only at 63, or even if we are only at 70, even if we are at 77, the policy was introduced fully across the country 5 years ago, free services. Why are we only at 77% today? If, in fact, the main constraint for mothers to access services is the cost of those services and facilities. It seems extremely unlikely that that is the only constraint on accessing these services. Otherwise, we should be at a much higher number by now. In fact, it is highly likely that there are additional constraints, including the fact that whatever the free maternity policy says, when women go to clinics, they are still charged for additional services. They don't find clinics in their area. They don't find access to these services in their area. They are mistreated by health workers. Whatever the various things which we know are challenges in the health sector, which may make it difficult to solve this problem only with one policy. And so here what we have is a problem of lack of clear information about needs. The finance information is a little bit better, although some of you will remember that 1 billion shillings went missing from this program a couple years ago, which we still haven't found out what happened to them. But the theory of change for policy also seems to be weak. If our theory of change, and I can only intuit what our theory of change is based on the policy because there's no policy document, but if our theory of change is that the only thing that is stopping women from accessing these services is cost at the facility, it doesn't seem to be a rich enough theory about how things are working or not working. So we, again, lacking important data and a sufficient theory of change, are not able to actually address this problem, and we will not address this problem. The third area that I want to mention is the Equalization Fund. The Equalization Fund was something that we sort of discussed on Tuesday at Equity Week. I say sort of because we had expected to have a bit more of a robust conversation with the Commission on Revenue Allocation, but they sent a lower level official to regale us with tales about the past rather than to inform us about the future. But in any case, the Commission on Revenue Allocation is modifying the Equalization Fund. They are currently in the process of revising the Equalization Fund, revising the marginalization policy, which informs the distribution of the Equalization Fund. But I want to refer to a set of conversations around the Equalization Fund. And I attended with John, who I didn't see earlier when I was mentioning colleagues from IBP. But we attended a meeting that the CRA had held on this question of how to revise the marginalization policy. And there was quite some debate about how this policy should be used. And one of the things that was said is that the purpose of the Equalization Fund is that it is a catch-up fund. Catch-up fund means that this is a fund that is meant to address the backlog or is to allow parts of the country which have deficits in capital, particularly roads, bridges, hospitals, et cetera, that kind of public capital investment, to catch up to other parts of the country. And this is not an unreasonable position to take, that if you read the Constitution, the Equalization Fund says that this is to be used to bring services in marginalized areas to the average level enjoyed by the rest of the country. So there's a reasonable interpretation that that is something like a catch-up fund. However, we have a problem. And the problem is, if you talk to most people, they will agree that this Equalization Fund is one of the most important tools that we have for addressing marginalization. And it all sort of fits together, right? It's supposed to address these capital backlogs in the catch-up fund. It's based on a marginalization policy, and it's called equalization. So it sounds like it's going to equalize. The problem is that there's very little money in this fund. So we are talking about now the cumulative amount of money in this fund is getting to 20 billion for all the money from the fund that hasn't been spent since 2010. 20 billion is very little money in the grand scheme of things. When you think about the amount of money that goes to counties each year now, which is on the order of 300 billion, 20 billion is very little. And that Equalization Fund money is growing at a very small rate because it is a very small fraction of the budget. So why do I bring this example? Because the expectations that we have for this fund, that most people have for this fund, are completely out of order with what this fund actually contains. ask yourself, what is the capital backlog in this country that would allow the marginalized parts of the country to catch up with the rest of the country, and whether 20 billion shillings is the order of magnitude necessary to achieve that kind of catch-up. Of course, we don't have the information, the detailed information that we would want to have to be able to answer that question. But if you ask yourself how much money it would take to bring Turkana, Mandera, Marsabit, Wajir, etc., to the level of the rest of the country, it should be clear to you that 20 billion shillings is not close to that amount. So we have this discussion that goes on and on, where we are talking about who's getting the money and why haven't we gotten the money and where's the money going and why isn't my county part of the 14 counties that's getting access to this fund. But imagine if all of the counties, because by the way, all of the counties are marginalized and they all want to access the fund. Imagine if the 20 billion was split between 47 counties and not just 14 counties. Then how useful would it become? So this discussion is divorced from reality. And why is that? Because we have a fundamental asymmetry between the needs and the financing. If you're actually realistic about the needs, and then you look at the financing, you will see that these two things don't speak to each other. And therefore, the equalization fund cannot be used in this way that it has been purported to be used, and we are having a meaningless conversation. So data about the actual needs, what it would take for the marginalized parts of the country to catch up to the rest of the country, if we had that information, it would help us to have a more realistic discussion about what the equalization fund can do and not do. This is important because if you go back to this conversation that I was referencing, where John and I were sitting together, our view has been that this money should be used to target the most marginalized sub-county areas. So let's take this down further, say, to the ward level, and identify the most marginalized wards. Because if we identify the most marginalized wards, with this small amount of money, we can actually do something in those wards. But there are many people who are arguing in this discussion that we're having that this was not acceptable and that this money was for counties. And the problem is that when you can make that argument, but when you make that argument without connecting it to the actual amounts of money and the needs that you're talking about, you are able to make an argument without connecting it to the fact, at the end of the day, what you are saying is that we are going to give 100 shillings to each person in 14 counties, and they will magically catch up with the rest of the country. Not realistic. Okay, I want to lastly mention something which is related to this and comes out of also from our discussions on Tuesday. It's from some data that John presented on the capital investment by the national government from the national budget. And we looked at, John presented information on the distribution of the roads budget. And so there are many gaps in the data that we have about how money for roads is being used in the country, including the fact that, for example, we have very large projects in the roads budget, such as the so-called low-volume seal roads. I have not yet met anyone who knows what that is, but it is 22 billion shillings or some thereabouts. And it's just a lump sum. We don't know where those roads are being built. But I don't want to focus on that. I want to focus on the bigger question here, which is there is information in the budget about the distribution of roads projects, although some things are not distributed, and that's what John presented. But the question we should be asking is, suppose that we have all of the information about how roads are being distributed, how should road money be distributed? What is the criteria by which it would be most equitable to distribute the budget for roads? And the fact is that we have no idea how to answer that question. No information has been provided about the criteria that we should use. So you might think, going back to what I was saying about the equalization fund, that the main criteria that we should use to distribute funds for new road construction is the capital backlog. In other words, we look around the country, we see who has roads and who doesn't have roads, we see who needs roads, and we do a calculation. We create some kind of index of people's relative access to roads, their need for roads, and we put money in those places where that index is low. That is, places where people don't have access to roads relative to the access that other people have. This would be some measure of the capital backlog. And this is the kind of thing that would be used by an investment bank or some other kind of an infrastructure bank or some other kind of policy mechanism that would be trying to resolve historical inequities and inequities in access. Where is that information? Al, do you have it? Al doesn't have it. If Al doesn't have it, it doesn't exist. So John pulls together information on the number of unpaved roads, the number of paved roads. We tried to sort of correlate this with population, with land area. But the fact is that we shouldn't be groping around in the dark trying to find data. In each of these cases that I have mentioned, I hope it is relatively easy for you to see. I don't know whether that is, I'm being told my time. It should be relatively easy to see why what I am saying is true and why it affects people's lives. We are often told that these discussions are so technical and it's so difficult. There's nothing technical about any of this. Basic questions. What is the need? What is the financing? What is the theory of change by which the financing addresses the needs? We need information about all three things. All three things, by the way, it is the responsibility of government to produce, but it is the responsibility of citizens to engage in that conversation and ask questions. And here, we get to the work that DI is trying to do with the spotlight. And if you look at the one of the papers, there are many papers you are given, but there's one that talks about Elgeyo-Marakwet County. And you can see that what they are trying to do, at least, is to bring together the data on the financing. The budget is on page 3 here, with some of the data on needs. There's health indicators on page 4. So that the public can also engage in this conversation, try to bring together information about needs with financing and ask the right questions. But also, if the information that we need is not there, which it is in many cases, this looks very nice, but we all know that there are lots of data gaps, and some of the data is also very outdated, that if it is not there, active citizens will demand that it be there. It is only possible for a government to take hundreds of billions of shillings, distribute it willy-nilly across the country without telling you where it's going and how it's addressing the capital backlog in your country. In other words, how is it, in simple language, how is it that this hundreds of billions of shillings that we are spending in the next 5 years is going to make it possible for people who do not have access to roads today to have access to roads tomorrow? It is only possible to distribute money willy-nilly without answering that question because we allow. We don't ask because Parliament allows these budgets to go through without asking any questions. So it is our responsibility to take whatever little data we have and begin to ask questions and put pressure on government to answer those questions. And the work that the Spotlight is doing, among other initiatives, to bring this data to the public, to make it easy to see both what's happening, to connect the needs and the financing, but also the gaps. What information do we lack is critical. And the East Africa Institute has also done this. This week they presented their own data portal, which is also another way of helping, and I'm sure Dr. Awidi will speak to this, to help active citizens who want to engage in these conversations, to engage and force government to respond in some way. So I want to stop there and just thank, again, Development Initiatives for the opportunity to speak with you and for the work that they're doing. And I hope that we will all be motivated to ask more questions and put more pressure on government, both the executive but also parliament. We have a new parliament, which I am told will start working one of these days. And now is the time to educate them about what their role is in oversight and what questions they need to ask. We were with, as a last point, we were with the other day with someone, Abraham and I were with someone from the County Assembly of Nairobi, and he was telling us about some things the executive was doing in the budget, and overestimating revenues, how much money the county is going to receive, which we know many counties have done. And I just said, look, I mean, who approves this budget? You are the ones who approve this budget. So when it comes to you with these unrealistic revenues, your role is to stop it in its tracks and send it back. You don't come to tell us a few months later, oh, this executive. No. that maybe your grandmother in the village can say, oh, these people. But you actually have an official responsibility to stop the nonsense. And we have a responsibility as citizens to put pressure on those assembly members and those parliamentarians so that they also step up and play the role which they are being paid very handsomely for. So I'll stop there. Thank you very much.
Thank you so much. Thank you so much, Jason, for that wonderful remark. Jason just tried to kind of unpack the existing inequality in this country. And I think everybody agrees, right from the government, decision maker, policy makers, to people at the grassroots, that inequality exists. But the problem is always, what can we do to address the situation? Even the equalization fund that you talk about, that is provided for in the Constitution. But it has taken time, ages, for the government to put in place structures to start distribution or redistribution of that equalization fund. So even in the health sector that you again talked so much about, there are so many challenges in the health sectors. So in all this, what are actions that we can take to address some of these problems? Progress has been made, but we know that there also gaps exist. So as one way of trying to address the problem of inequality, the development initiative, the Spotlight, try to bring the aspect of information and data to encourage evidence-based decision-making in trying to ensure that the resources are targeted rightly to address inequality. So without saying much, I want to welcome Steve Kene just to take us through what the Spotlight is, and we move to the next session. Steve, welcome.
Morning, everyone. I hope I'm audible. From the last two speakers, it's customary to first start with Zimbabwe and Mugabe. So I don't have much to say about that, except for I am hoping that it actually transpires into something positive for Africa. Let's cross our fingers on that. Unfortunately, I have a really, really bad cold. If I stop and pause for a cough here or there, I'm not trying to do an impression of Theresa May. I just need to clear my throat. My name is Steve-K. I'm a data scientist with Development Initiatives. And I want to be really brief. Karen, Henry, and Jason all touched on quite a bit of things I wanted to speak about in my presentation. In fact, while Jason was speaking here, I think I reduced my presentation by about 8 slides. So thank you very much. All right, so I'll be brief. Let me start by, I'll just expound on one aspect of what we are trying to do as DI. So as Karen told you guys earlier, we are an international independent organization and we work primarily around data use, and this data use is specifically for helping to effectively target interventions that would reach a need on the ground. All right. So we work in we headquartered in the UK, but we have an office in Uganda, Kenya, and Nepal, and Brazil and US. Our focus is on 3 areas: poverty, resources to end the poverty, and data use to provide evidence-based decision making. So they're all interlinked. You cannot have one without the other one. So I'll speak a bit briefly about what we are trying to do around poverty. So we have this thing we are calling the P20 initiative, but it's a bit, the concept is a bit too technical for the time I have up here. But in a nutshell, we are of the opinion that if you want to tailor interventions that will meet a need on the ground for the poorest, you must understand their basic characteristics. And we're reducing these basic characteristics down to 5 key elements that must be associated with any data set that is supposedly centered around people. So it must have, you must understand how much, or their income brackets. You must know where they are, so that the data must have a geographic component. It must be disaggregated by gender. It has to be disaggregated by disability, and it also has to be disaggregated by age. So once you have all of these 5 together, there are other things, there are other elements that you can add on that will improve the data set and provide a much richer characteristic of individuals. But we are saying these 5 are primary if you really want to do something on the ground. So that's what we are calling the P20 initiative. Let me just keep through this. And I need to shout out to Al here. We do a lot of things in partnership. So Equity Week, we're in partnership with IBP. We are together with the Open Institute. We are trying to localize SDGs and what it actually means at county level to the local Mwananchi. And if we have time later on, anyone who's interested around what we're doing there. Basically, we are trying to do a mini census. If you want to know more about that, we can have a chart on the side. And this is what we are going to be speaking about today, our Development Data Hub. So what the Development Data Hub is it's a portal that allows you to overlay socioeconomic indicators together with resources going to the ground. So you're able to see whether the money is actually meeting a need on the ground, or it's, if your health indicators at county level are really good, but your education socioeconomic indicators are really poor. When you look at the budgets, you expect that the county would be focusing a little bit more on education rather than health. But basically, that's what the Data Hub wants to do. And I'm just going to skip through all of this and just pause at this one. Our vision is to ensure that the Agenda 2013 actually happens, and specifically for goal number 1. We really want to see the end of extreme poverty. Just to summarize everything that I've said, we want to do this through looking at resources and looking at data on the people that these resources are supposed to be targeting, and ensuring that there is evidence-based decision-making that goes into policy development. Yeah, we hope by 2030 things will be, I don't want another 15-year plan. I think we just, let's do this once and for all and just move on. All right, so yeah, now I'd like just to, this is pretty much what Jason was talking about. And what we're trying to do with the spotlight is highlight the geographic disparities that is masked within national statistics. So Kenya, according to the last publicly available data set, the national poverty headcount stands at 45.2% of the national population. But this does not translate very well when you look at it subnationally. The areas where people are really, really poor, and the areas where they are not, it's not so bad. But just keep that 45.2% figure in mind. If you look at the top 10, the font is not really doing me justice here, but yeah, you take my word for it. The top 10 poorest counties in Kenya actually average almost double, not average, the actual figure for poverty headcount is almost double the national average. So if you go to Turkana, which is the most poorest, you find that 87.5% of individuals living in Turkana live below the poverty line. And the number 10 county is Makueni with 60.6. So the areas geographically where if you want to start addressing poverty in Kenya, you're better off focusing resources in those areas rather than sending, trying to target interventions in Nairobi and other similarly developed counties. All right. And this is what basically I was saying. So what the Spotlight has, the socioeconomic data that we have are centered around 5 key themes. So poverty, vulnerability, population and demographics, education data, health data, water and sanitation, and now the county resource profiles. And we'll speak a bit more about the county public resources because it's a nightmare, that one. As Jason was saying to you, we are presenting socioeconomic data as well as visualizing how they're getting the resources and how they're spending them. So for this, I think let's just jump into the live demonstration. Who knows where the switch is for? There should be pamphlets on your desks that will not this one, small one. Not like this, yeah, like that one, yeah. It will give you a bit more understanding of what the Data Hub is. And it will also give you a link to the portal itself. So the Spotlight on Kenya is hosted on our data platform. That's data.devnit.org /spotlight on Kenya. And once you, I don't know if it's really clear enough, let me zoom in a bit. Okay. So, at the risk of repeating myself, the Spotlight on Kenya is a comprehensive resource of Kenya's financial resource flow data overlaid with socioeconomic data at the subnational level. So the first page you land on for Kenya is our visualization on poverty and vulnerability characteristics subnationally. So it's true to form. Basically, everyone knows the northern, northeastern areas of Kenya are quite underdeveloped, and the data backs this up. As I said, Turkana is the poorest county by head count in Kenya with 85%. So we have here, we have the poverty head count. We also have the poverty gap. But the interesting one, I think, is also the HDI. When we're talking about inequality, you will find that the poverty head count and HDI figures actually mirror each other. Those areas where you would think are marginalized in Kenya are actually marginalized, and there is data to back that up, and that's the northern and northeastern areas of Kenya. We also have demographic population characteristics. So total population is based on the 2009 census by county. We also have the density and the rural-urban population split by county. And I think personally the interesting visual for me here is on population density. It seems the greater majority of people in Kenya live within a really narrow strip of the country, central to western Kenya. And it looks like the entire north, northeast, south, east of Kenya is not populated at all, according to the visualization. But if you look at so when we're talking about inequality, there are certain inferences you can make from data. So when you look at this map and you see how densely, or rather, certain areas are very less densely populated, and you want to understand a bit more where are these people staying who are in those less in the less densely populated areas. If you do that, you'll find that most of the people living in north and the northeast of Kenya actually live in the the figures look like boys are actually enrolling twice as much as girls, and that's something that I would have thought by now things would be a bit better. But anyway, that's that. And for health, we have also quite a bit of indicators. But in general, above 85, some 99, others are 100%. And then you go to certain areas and you find the 25 in Marsabit, in Samburu 22, Wajir 21. So there are services that are needed in these areas that are not being, there's a need that is not being met in these areas. And that is true for most of these indicators except for malaria. There are some, and that is because some areas in Kenya are malaria prone than the others. So when you notice, if you take, for example, children being treated for with anti-malarial drugs, Elgeyo Marakwet has 2% of its the children that are being treated with antimalarial drugs, but it's not a malaria prone area, so that you must understand a bit more of the context on the ground for you to make some inferences. And then water and sanitation as well, the picture is still the same. Is we are trying to match socioeconomic indicators as well as costs and analyze this even further in terms of how they're actually spending it. But there is a slight challenge with how budgets are released by counties. So if you look at 2017, you'd think only, I should not think, but we have data from less than 15 counties presented up there. But over time, so what you're trying to do is also allow you to scroll over time and see how much counties are spending. This is specifically for agriculture, but it's also for health. And we allow you to see what they're raising locally, what they're getting from the national government. But this is proving to be a challenge, and we are hoping from now, and once we start engaging a bit more with the counties, government starting from tomorrow, we will be able to fill some of these gaps. Most of these are not because the information is not there in the budgets that were available to us. It's also about how they present the information. So you'd find they have Ministry of Livestock, Agriculture, Fisheries, and probably housing. I'm just, I know housing and agriculture is not related, but you would find, that you would lump sectors into one line ministry, and when you try and break down the budget, you wouldn't know what is being spent for agriculture. So the visualization will appear like there is no data, but once you go into the county, you will see that there is information in terms of resource flows. So let's just do that now and jump into Elgeyo Marakwet. So again, you get a brief overview of the socioeconomic indicators. So tell you how many people in the county live below the poverty line. There's a bit more population dynamics indicators there. Education and health. But he also tell you that in this is 2014, Elgeyo had 33.7 million shillings, dollars to spend. And this translates to about the spend of $90 per person, actually $91 per person for the county. And if you scroll down, you can see the main source of revenue was from the national government. They got 36% from there, and then they raised themselves 7.73 million. And this is how they spent their money in 2014. Most of it went into administration and health and infrastructure. maintenance of roads and so on. That's how they're spending it, and we're doing this for for virtually all the counties. There are some that the data is available, but we have for most of the counties. So if you're interested in finding out how your county is performing, how they're spending their money, just go to the Spotlight and then check it out. As I said, it's not yet perfect because of some of these data issues, but this is something that we are hoping to address together with county governments and through leveraging on the partnerships with Ibp, OI, and other like-minded data-focused organizations. So I think with that, given that time is a bit short, I would like to end here and ask you guys if you have any questions for me. Thank you.
Thanks so much, Steve, for the presentation. Just like Steve has said, is it working? Can you hear me? Yeah, just like Steve has said, we don't say that Spotlight, what Steve has just shown here, is a final product. It is something, it's just an example of how technology can be used to drive poverty eradication or to address the issues of inequalities. And we are so much keen to receive your suggestions, recommendations, comments on how we can make this platform perfect, something perfect. So we have a few minutes for questions. Question to Steve. Anybody with question? Have a question? Yeah. So you just raise your hand up. You have a question. I'll pass the microphone.
I was looking to inquire how adaptable and how responsive are the visualizations you provide, especially if you think of the health sector. Is it possible to adapt this and use it in something that needs real-time data such as, say, disaster risk and management?
I think we take any more question, then you can answer them together. Any other question? Question, comment?
Thank you so much for that presentation. I've been looking forward to see what we have. But I am just also interested to find not just the adaptability question part of it, but also the fact that Jason talked about needs and financing. I see a lot of focus is on the needs, the issues that are affecting these areas in terms of service delivery. Have you been able to find any data on the financing aspects of it, even if it's at a scratch? You talked, for instance, about the kind of medication or health services provided to children where there is misdiagnosis and things like that. But I'm interested about the financing side of it or the response side of it, whether you have any data that can help us overlay that kind of conversation. Thanks.
Yeah, I think it's good. It's great that we're seeing a lot of things happening, more so if we have the visualization, because that helps policymakers have a quick way of looking at the data. But I was thinking that going forward, we would think of, putting several variables together. Multivariate analysis gives better insights than single, so that your Spotlight moves from just from the state where it is a repository to a place where we can come out with some insights that can help us to make decisions forward. Otherwise, I think it's a good initiative and it looks good.
Steve, I think you can respond to those questions.
So the I think I skipped something quite important about the data used for the visualizations. So if you at every indicator, there's a small eye over there, the information icon. If you click, if you hover above it, it will give you. I don't know why it's not loading. I'll just speak. So we have information about where we're getting our data from. We are not a data producer, so we rely heavily on data from the National Bureau of Statistics and the line ministries for health and education. But most of the socioeconomic poverty vulnerability data is from the National Bureau of Statistics. We are building right now a download function, and you'll be able to download most of this data on CSV via GitHub very soon, and you can use that to generate your own analysis visuals. So we are going to have that option. What we won't have is an API, because we don't own any of this data. So, but we point you to the actual data source. So if you're interested in finding out a bit more, you would know this. Like most of the population information is from the population census 2009. The HDI is of course from UNDP. The education data is from the statistical booklets from the Ministry of Education. Health is from Demographic Health Survey 2014. So we have that, we qualify where we get our information from, and the budgets are from the county government themselves. But we'll build a download function, and we'll allow guys to take that and use in their own analysis, because that's what we want anyway at the end of the day, to inform evidence-based decision making. And my evidence might not be your evidence, so why not be able to play around with it? I think I've answered both questions at once, right? All those years are very different from the first one. You're asking about financing, yeah. Yes, there is, and I don't know why I'm not online. If when you have the opportunity, if you go to the spotlight, just click on any county. You will see that there is information about resource flows, and we've tried to narrow this down to sectors. So you'll see how much they're spending on the line Ministry for Education, for health, or so on, and then you can compare that with the specific socioeconomic indicator that you wanted to find out about. So there is that information that is there, and I tried to show on using the LGO market profile.
Again, if you look at the health sector, in the conversation today, there seems to be a focus on expenditure as what you're tracking. But if you consider the health system, the pillars of health, where you have health information systems, human resources for health, health service delivery, governance, and health financing, I believe that there would be congruence in in all those other pillars, including governance as well. For example, for human resources for health, do you show the aggregation of human resources for health, where they are, their geographical distribution? On health financing, do you also work on mapping of resources available in the country? Do you look at allocative efficiencies and things in that general direction? Or are you purely on the health financing pillar?
Thank you. That was a very informing presentation. My question is that the fact sheet that we got relates to Elgeyo Marakwet, and there's a lot of information on the county. I'm asking for you to have focus on Elgeyo Marakwet for today. Have you, has DI tried to engage the local leadership in any way? And if so, what model are you using, and what are the experiences? Especially because the agenda of the week shows that tomorrow you'll be in Elgeyo Marakwet. We are not trying to preempt what you'll be doing tomorrow, but especially for some of us who won't be there, we want to hear just a little more of the organization's involvement in Elgeyo Marakwet. Thanks. Okay, in the counties, but you know, it's the organization that chose to give us a little more information on the county, and therefore, even though perhaps you'll be going to other counties, my main interest is on Elgeyo Marakwet.
Let me first start. What's your name again? Sorry. Emmanuel, sorry. I can only start with Emmanuel. So what the spotlight is, we are focusing centrally on county resources. So we're not looking at national figures for, you know, we don't focus on the health budget at line ministry at national level. What we're interested in is the funds sent to the counties from national government. How do they split it themselves at county level into now those line sectors, so health, education, and so on and so on. So how they're reporting is how you're presenting. So you'll find for some counties, the budget information is very detailed, and that's why I'm jumping into Elgeyo. Elgeyo has been one of the most consistent counties in terms of presenting budgetary information. So we have data actually from 2013, sorry, to 2017 for Elgeyo, and it's primarily why we chose to do the profile on them, because the data was quite detailed and good. There are other counties that have quality data, and some that are trying. West Pokot is one, Taita is another one. But we have done some work at county level tracking health service delivery. So we did this in Nakuru, Mombasa, and Busia. We try as very much as possible to work with county governments. But we've only been in, we are not a very old organization. In fact, we are new. So we are still looking at more opportunities to engage with county governments, and we will be present tomorrow in Elgeyo, and we'll be presenting this profile, and we'll also be presenting the spotlight itself. And we are hoping that this tool becomes of use for not just policymakers, not just policymakers at county level, but also, you know, just local wananchi, to be able to see what resources, what sectors the county governments are prioritizing, and then in that debate on what is priority, what is not.
Thank you very much for the information. Why I had asked this is because CANCO is implementing a program, Grassroots, the Grassroots model, and it's trying, right now it's in 14 counties, and basically our first thing is to do, to get data, and to me, if we are going to get data from DI, then that will already have shortened our work, because mostly we get data and then make the data into issues and then engage the citizens to advocate for better services or better budget allocation. And therefore, I think this presentation has been very valuable to CANCO. I think we are going to talk a little more out of the formal program, so that we see where do you have data, and therefore where do we avoid replicating the exercise. We just get data from you, so long as you don't mind the partnership, and therefore I think we'll take this further and maybe even make a visit to you. Thanks.
Yeah, actually, on that note, I think it's high time I mentioned to you guys that we have a help desk function being hosted at the hub in Nairobi. We try and help organizations with their data issues. So I'll extend the invitation to you and to anyone else who wants to make use of the help desk function.
Thanks so much, Steve. Yeah, I think we can pursue further discussion with CANCO and with anybody else, any other organization, to see how we can interface what we're doing with the Spotlight and some of the work that you could be doing. Now, because of the time, I have a request to make. And my request is this. I know that maybe there could be some more questions. You could be having some more questions. But I want to encourage everyone to interact with the platform. And please contact us. If you want if you have questions, you want responses, please contact us. We will answer your question. For now, I just want I want us to have 2 minutes, a quick break, 2 minutes. You can have tea or you can, 2 minutes, and then we come back for the last segment of the agenda, which is a panel discussion. Like I said, we have a expert panel that's going to take us through, discuss some of the issues that are there, challenges in the data, the gaps are there, and also the inequality broadly. So 2 minutes, quick break, and then we come back for the panel discussion. Thank you so much.